everyone, Kay Berkner here today with Dr. Tom Phelan, author and creator of 123 Magic, the author of The Manager Mom Epidemic, and relevantly for today, the author of All About ADHD. So today we are going to be talking about ADHD, and Dr. Phelan, you have a lot of both personal and professional experience with that. Is this correct?
This is correct. Some days more experience than I want. Some days it's a favorite topic, and some days you wish you never heard of it. But it can be very, very stressful. It's very, very relevant. There are a lot of children that are affected by this, and a lot of adults that are affected by it too.
Absolutely. So tell us, can you start by telling us exactly what ADHD is?
Yeah, you can think basically in terms of the three symptoms. So the way they think about it now is that it's a difficulty focusing, maybe a little more than that, difficulty with self-control as well as focusing. But these kids in schoolroom will have a hard time focusing on subjects unless they're really interested in them. And they also, kids with ADHD also tend to be impulsive is the second symptom that they deal with. And that means sort of acting without thinking or responding to the first thing that comes into your vision or into your brain or whatever. And then a third symptom is the old one that they used to talk about, and that's hyperactivity or restlessness driven by a motor. And we do have about a third of the ADHD kids will not be the hyperactive variety, or what we call the combined type. They'll be what we call inattentive only. So they have what some people call the pleasant space cadet syndrome. They have difficulty focusing and so on, but they're not a lot of behavioral issues, or they're not as disruptive.
Gotcha. Okay, great. And at what age might parents start to notice these types of behaviors in their child?
Well, it depends on which symptom we're talking about. So if we're talking about inattentiveness, you're not going to really notice it because most preschoolers are inattentive anyway, and you're not going to get a preschooler on inattention. So for the inattentiveness, you're not likely to see that so much till kindergarten or maybe first grade, second grade. It gets to be more of an issue as the kids are required to sit still and concentrate, for a whole day. What you can get, though, is a lot of the impulsivity and sometimes aggressiveness and the hyperactivity in the little kids. Sadly, one of the symptoms we see very often is that these kids have been kicked out of preschools, and often it's for socially aggressive behavior. And so when you see that, you can diagnose some kids as early as age about 3.5 or so. But a lot of the time, if you're looking at the inattention, it's not going to come up until the elementary school years.
Got it. Okay, so we've talked about how ADHD kids might behave at school. Hi, Jennifer. Thank you for joining us. What might this look like at home in terms of how a child might interact with parents, how a child might interact with siblings, or even with friends?
What you're going to find at home is a lot of parents will use that driven by a motor phrase. He just doesn't stop. He's loud, he's intrusive, he interrupts. Usually it's a he, that's why I pick on the boys here. He doesn't go to bed when he's supposed to go to bed. And one of the primary symptoms is sibling rivalry, which is difficult anyway in most families, is often bordering on, I don't want to use the word horrible, but maybe I should. It's really, really difficult with children with ADHD. They love to pick fights. They just seem to enjoy causing trouble. But you'll find that compliance and behavior disruption sort of things, the kid does not comply to ordinary requests as often as, little kids are not that good at complying anyway. Kids with ADHD are worse. So what you're going to find is that this is going to be very stressful. And usually the person that gets whacked first is the mother. Because moms still are kind of charged with more primary child care than dads are these days. And so the mom usually feels the brunt of this. In fact, some of the kids with ADHD respond better to their fathers because dads are more intimidating. And so mom and dad then start arguing about, is the problem due to mom's parenting deficits and dad's a great parent, moms? And it's not that. It's this kid's difficult for everybody.
Yeah. So, when you talk about responding more to dad because maybe dad's more intimidating, can you talk about does the 123 Magic program work for kids with ADHD?
Yeah, it does work. I tell you, and not only does it work, it was based on a large cohort children with ADHD, including some people that were very close to me. And so it was developed a lot with ADHD kid. And we often say, if you can control a child with ADHD, you can control anybody. And so a lot of it's no nonsense, it's down to earth, no arguing, yelling, spanking. But you really have to know your stuff. If you have a child with ADHD, I always tell parents, you have to be pretty much a professional parent. You really got to know what you're doing.
Yeah, and I know that one of the things that you talk about in the book is one of the challenges that parents have is parenting doesn't come with a manual. And kids in general, whether they have ADHD, whether they have a behavioral challenge, anything like that, they don't come with manuals either. So the 1-2-3 Magic program really provides a great set of guidelines and behaviors for parents to follow, to kind of help manage challenging or frustrating behaviors at home. And that definitely can show up more with ADHD kids. And if a child is ADHD, what is the likelihood that one of the parents may be ADD or ADHD as well?
I think it's around 50%. So it's a highly genetic disorder. And they say about 80% genetic, whatever that means, but it means that moms and dads can pass along the genes. And so it's not something you need to feel guilty about. You've got the genes, you got them from somebody else. You didn't create them and wrap them up and then pass them on. But it's not caused by bad parenting, and it's important to keep that in mind, because a lot of parents feel guilty when they see these behaviors in their kids. However, it's also important to keep in mind that ADHD is not caused by bad parenting, but it sure can be aggravated by bad parenting or ignorant parenting or whatever. So you definitely have a job to do, even though it's not your fault.
Yeah. So what types of things might parents do that would cause bigger challenges?
Uh, well, if you, the one thing that a lot of parents do, whether they have kids with ADHD or not, is when they have a problem, like it's bedtime or whatever, they will default to reasoning. And reasoning means talking. And so it's time for bed. Well, I don't want to go to bed. Well, you have to go to bed because you have to get your sleep for tomorrow. Now we're into reasoning. Well, that's really stupid. I don't feel like going to bed. Listen, young man, you're going to do what I tell you. And we have these ridiculous conversations. What you need for bedtime is a routine. You need a routine that's been rehearsed and practiced and so on. And 1-2-3 Magic, that's what we talk about. You get kids that are arguing, yelling, whining, fighting, screaming, ADHD. What are you going to do with that? Listening, man, I don't want you treating your sister like that. It hurts her feelings and so on. Now we're into another discussion that's going nowhere. That's not a useful thing. You have to do something else, and we recommend counting for that. So with ADHD, I think in any kind of parenting, the big question you have to ask yourself is, what do I do when talking doesn't work? And that's the question we answer in the 1-2-3 Magic for parents of kids with ADHD.
Terrific. Yeah, because I joined Dr. Phelan for a seminar that he gave yesterday, and he was talking about the little adult assumption, which is what causes a lot of us parents to try to reason with and talk to our kids, because we just think that they're little adults, that they will of course respond reasonably when we just calmly explain why it is they should do something. And obviously most kids, particularly younger kids, that is not the case. They do not in fact do that.
No, and if you try it and it doesn't work, now you got two problems. Number one, the kid's misbehaving, and number two, your cherished strategy that you think, as you said, should work doesn't work. Now I'm mad about two separate things, and I got this kid that's not cooperating. We're going the wrong direction real fast.
Absolutely. And if you could just share one more thing for us that I thought was so valuable when we talked about kids with ADHD the last time, and that's the 30% rule. Can you tell us what the 30% rule is, and how parents can use that to kind of adjust expectations?
Yes, the 30% rule, this comes, I think, from Russ Barkley. The 30% rule goes like that. I'll give you an example first, and then I'll sort of explain it. Say you have a child with ADHD and they're 12 years old. What we do with the 30% rule is we take 30% of their age and chop it off. And so if we take 30% of 12, you get 3.6. You chop that off at 12, you get age of 8.4. And what is that? That means they're a better estimate of their emotional and behavioral maturity is 8.4, not 12, not their chronological age. It's a sort of their emotional behavioral age, which is 8.4. So if you have a 12-year-old could be in 7th grade, you have a 8.4-year-old that could be in 3rd grade. It's a big difference in maturity. But if you have a 12-year-old with ADHD, you want to, it sounds funny, but you kind of want to lower your expectations of them and think of them as a younger child and use strategies that you would use with a younger child, very gentle, strategies, but for things like bedtime, and homework and sibling rivalry and that. So it's a way of adjusting your expectations for teachers as well as for parents. And a lot of parents find it enlightening and helpful.
Terrific. Well, thank you so much, Dr. Phelan. So just to summarize quickly, adjusting your expectations for a child with ADHD to be at a sort of social and behavioral development level that's appropriate, not trying to talk and reasoning, instead using a calm, firm, non-argumentative discipline program like 1-2-3 Magic, which was developed with a large cohort of ADHD kids. And remembering that ADHD it's not like you didn't do anything to make your child become ADHD. It's not caused by your parenting, but it can be made either worse or better by the way that you choose to parent your child.
I think that would sum it up. And just if I could add just 2 other things. One is if you do have a child, you'll want to do an evaluation at some point. And then that person that does the evaluation or somebody, you want them to be sort of a team leader for you throughout the years as you go on. You need some coaching and you need some moral support. And you also definitely want to explore your medication options. Medication is doesn't cure anything, but it's a very powerful resource and a big help for both school as well as home.
Wonderful. Well, thank you so much, Dr. Phelan. This has been so helpful. If you know someone who needs to hear this, please feel free to share this video or tag them in the comments. If you're not already, head on over to 123magic.com to get signed up for our newsletter where we send out weekly parenting tips and more. And if you want to go deeper into this topic, Dr. Phelan will be doing a free seminar next week. So I'll post the link to that in the comments of the video here, as well as pinning it to the top of the Facebook page once we're done. Thank you so much.
Thanks, Jay.